Do you want me to hit admit all?
Good evening, everybody, and thank you for joining us for the North Shore Radon Awareness webinar. We appreciate all of the attendees that have taken time out of their schedule today to learn more about radon. My name is Tanya, and on behalf of the North Shore Health Department and the Southeastern Wisconsin Radar Information Center, welcome to our webinar. Before we begin, I'd like to introduce our team. So we have from the North Shore Health Department, Becky Rowland, Health Officer, Avery Peters, Public Health Intern, and myself, Tanya Bosheff, Public Health Strategist. From the Southeastern Wisconsin Radon Information Center, we have Skylar Bean and Steve Todd. A few quick notes before we dive in. Avery is going to be monitoring the questions, so please feel free to type in your questions in the Q&A at any time, or you can wait until the end to also ask questions. The webinar is also being recorded, and once available, we'll share it through our newsletter and social media. If you're not subscribed to our newsletter, we will share sign-up information at the end of this webinar. So over the past 6 weeks, we've distributed over 100 radon test kits across the North Shore, which is a huge jump, considering you usually do about 30 to 40 kits per year. This increase, along with expanded community awareness, is thanks to the collective awareness of everyone involved. We truly appreciate everyone's support in spreading the word about radon. This webinar and the success of our radon awareness program wouldn't be possible without the partnership we have with the Southeastern Wisconsin Radon Information Center. These centers provide essential guidance on radon testing, mitigation, and helping homeowners take action. So I just want to take a moment to say special thanks to Skylar and Steve for their expertise and their support. We're excited to continue working together to expand North Shore radon education and awareness in the year-round. Steve, did you want to take a few minutes to explain more about the Radon Information Center?
Can you hear me okay?
Yes, we can.
Okay. Yeah, thanks, North Shore, for inviting us. Skylar and myself both work for Waukesha County Environmental Health, and we receive a grant from Madison to operate the Southeast Wisconsin Radon Information Center, whose jurisdiction is Waukesha, Milwaukee, and Racine counties. We do radon education and basically help out the local health departments in any way needed with questions, test kits, and any type of educational events that we can. So we appreciate you inviting us tonight, and hopefully it'll be meaningful for your residents to hear is what we can tell them about radon. Thank you.
Again, thank you both. So Becky, could you share with us about what radon is and why folks should care about it?
Absolutely. I'll do my best. I would like to give the public health perspective and welcome everyone. And I also want to extend my gratitude for the work, time, and effort that folks put in for this project. And I'm excited for some rich conversation this evening. So I wanted to approach radon in the North Shore, give a cursory, high-level once-over so that Skylar and Steve could really kind of dig into what do we do about this. So some folks might already know that radon's naturally occurring, and it's actually radioactive, which is why it's a cancer-causing agent, right? Radioactivity mutates our cells, or has the capacity to do so. And while we can't see it or smell it, the risk is dependent on lots of factors, including how long an individual is exposed, the concentration of radon in the environment that they are in most of the time. Whether or not they smoke really has a lot to do with the negative impact that radon could have on an individual and the age during the exposure of the individual. So what we do know is that it leaks into homes and it's very common in Wisconsin, and it's most commonly found in basements of buildings. Think when things are built into past the topsoil and really digging into the ground and disrupting small pockets of air and radon that are down there. So nationally, the EPA estimates that about 21,000 people die each year from radon-related lung cancer, and it's second only to smoking. And so it's one of those things because it's tasteless, odorless, colorless. It people don't necessarily always understand it or believe that it exists, but in the public health world, we know that it's quite prevalent, especially in our state. Next slide. Yeah, thanks. So I wanted to just drill down a little bit about like the measurements of radon, because I thought that that was the most foreign component of this. So radon is measured in what's called picocuries per liter. And I'm not going to get into the weeds too much, but I wanted people to understand what we're measuring with the kits that hundreds or dozens of people have purchased in the last month. A picocurie is specifically a unit of measurement that for radioactivity. So it's not necessarily based on exposure, right? It's what's around us. And that's why it's different from something like a REM that would be counted by a Geiger counter. A picocurie is 1/1,000,000th of a curie. So I don't even know how to explain or how to support people to wrap their minds around what a 1/1,000,000th of anything is. But what we do know is that the EPA and the WHO want a very, very low concentration of radon before we have an action level reached. So EPA says no more than 4 picocuries and WHO says no more than 2.7. So we like to split the difference and highlight both. Pardon me. Wisconsin has high levels of radon because of our geological makeup, and so that's why we're a little unique. I'm from Chicago, and this wasn't really something I knew about when I was, growing up. My parents did not have a radon mitigation, so it's specifically connected to our naturally occurring uranium in our soil. It's amplified by the glacial activity, and so we know that that's like a big part of Wisconsin geology and geography is those perhaps like think of our kettles and our rock formations and places like Devil's Lake with tumbled rock. And there's a lot of evidence of this, but that amplifies the concentration and where radon gets stuck. So the remaining soil and rock formations can release radon into the air. And when we build houses on those, that comes out and we disturb those foundations, those granite or those rock formations, that's when we start to have radon entering our spaces. Another thing I've learned in my training is that the way we build houses now compared to having a 100-year-old house, those houses breathe a lot better than newer houses. They're pretty tightly buttoned up, and so that kind of presents a different beast. Or if we replace windows in old houses, we're changing the game a little bit, so we're keeping that radon in the house a little more often. So it's important to test if you make changes like that. Lastly, radon levels can fluctuate with weather conditions, like temperature, pressure, and humidity. And if you think about things coming in and out and the way air moves through a room, that makes sense that all of those components would also change our exposure. So lastly, why we're having this meeting and this webinar tonight is that radon is found in every zip code in Wisconsin, including all of the 5 North Shore zip codes that we serve. So I love this, thanks to the Wisconsin DHS, and that this heat map essentially of where radon is found in Wisconsin is a great demonstration. And then what we have on the left is a chart from recent data that is gathered from this map. The link is, we are happy to send it out to individuals who want to poke around. But these data show, of numbers of homes tested in each of these, how many actual homes tested over that 4 level of picocuries per liter. And then additionally includes what the median level was of those samples, so the whole sample. So for example, if we look at that first column at 53223, which is Brown Deer, 200 homes were tested, 65 had elevated levels of those 200. The median for the community in those 200 homes was 4.6 picocuries per liter, which is concerning, right? Because that's over the 4.0. And the maximum level that was tested in those 200 homes was 40.6. And so that is for future reference, and we'll be happily send out that information, but wanted to make sure that this hits home for folks. And then the last slide for me today is just kind of talking about why do we care, right? What's the public health risk? And then we'll have the experts really take it away. But again, just to double back on that, radon is the second leading cause of lung cancer. And if one smokes, it can make things up to 10 times worse. Really, it just doubles the harm that can be caused, or 10 times, I guess it's the log, right? But the harm from radon, and I kind of wanted to drill this point home because it's not an acute exposure that we're really looking at when it's a situation like this, right? The harm from radon occurs over long-term exposure. And so I tried to think about my questions in this of like, what does that mean? And that typically means years of living in an environment with elevated radon levels. The damage that to our body is cumulative, and radon is considered chronic risk rather than an immediate one, right? That's why the testing is over a few days, why we don't test that often, even, and why we don't hear about it that much is probably related to this like long-term exposure, right? It's not front of mind because we don't notice the immediate impacts of our exposure. And then I kind of wanted to drill down. I was thinking those questions like, what is long-term exposure? And the US EPA estimates that lung cancer risks on a lifetime are really based on 18 hours a day spent indoors for 70 years. So it gives you a little perspective. But there's lots of charts like the one on the left, or this infographic. This was the best one I could find, and it was from the CDC. So it was a more trustworthy than a typical like radon mitigation service. But some of these concepts, like having 4 picocuries per liter in your home, is similar to smoking 8 cigarettes a day. It gives you kind of a little perspective, and I won't go into the weeds on the algorithms here, but I like when things make you think and give you a little different perspective, help you understand the gravity of the situation. So I will hand it off to Tanya.
Thank you, Becky. Appreciate that. So Skylar and Steve are going to dive into some of the key radon facts and help explain some commonly asked questions. They'll help us understand radon better, how to test for it, what to do if it's in your home, and how we can reduce the risks. Skylar, would you mind explaining how we could test for radon? I know when I first learned about radon, some of my questions were, how do I test my home for radon? Are DIY radon kits accurate? Where should I place that test? Can radon levels change over time? Things like that.
Yeah, definitely. So for first-time home testers, we recommend using a short-term test kit. Those are kits that run from typically it's 2 days to 7 days. The ones that the county and that North Shore sells are they run from 2 to 4 days. So you just pay attention to the instructions that come with the kit for how long you should run it. But we recommend that short-term test because if you have a problem in your home with high radon, you want to find out right away. The other option is a long-term test. That's usually used as a follow-up depending on the result of your short-term test kit. Those go from 3 months to a year, those long-term tests. And those are nice as a follow-up if your levels are maybe like right around 4 or 3 or 5, like they're in that kind of questionable area that you want to have more confirmation. You can check across different seasons and have a better understanding of what your annual average exposure is, because radon levels do fluctuate over seasons. Sometimes storm events or something going on in your, the way your home is being used. If you have a lot of people in your house, it might affect a short-term radon test kit a little bit. Those results might be impacted. So when you're kind of borderline, that's when you follow up with a long-term test kit. And then the final option would be to hire a professional. And you can get those off the state-run website, DHS website, lowradon.org. There's a list of certified professionals, and they're typically used for real estate transactions because what they use is called a continuous radon monitor, and it can kind of test if someone's trying to mess with the test. It'll tell you, it reads pressure, it reads temperature, it gives you like readings at every hour typically. So if someone wants to try and open a window to get the radon levels down, that test will kind of prevent that from happening, or it'll alert you that something might have happened. So that's kind of the third option for radon testing. So the next question, are do-it-yourself kits accurate? I can't really speak too much to the ones that are sold in hardware stores, but the ones that us in North Shore sell and other local health departments, that if they get it through us, we do at the county level or at the RIC level and at the state level do quality control on our kits. So we are very confident in the results of both our short-term and long-term kits. So where should you place your radon in your test kit in your home? If this is for your own personal knowledge, you want to do it in the lowest lived-in level of your home. So if you never use your basement, if it's unfinished, if you just have a washer and dryer down there, then you could do it on your first floor. If it's for a real estate transaction, you'd want to use the basement because you want to test where someone could possibly spend a lot of time. So even if your basement's not finished, for a real estate transaction, you never know if the next person that moves into the house is going to finish the basement. I apologize. My cat, of course, is pestering me. So it's going to be highest in those lower levels. So that's why you want to test those areas. The next question is, so when you're placing the test kit, you want to keep it away from humidity. So you don't want to put it in a bathroom or right in a laundry room or next to your sump crack. You want to use it like, I would say, a bedroom or a living room, or if you have a den in your basement, kind of place it in the breathing space. So you don't want to put it right next to the floor. You don't want to put it up against the wall. You want at least 4 inches of space so air can really travel around the kit. This is what the short-term kit looks like once you take off the plastic wrapping. So it's really, the air is just, as it goes over the kit, it gets absorbed by this charcoal, and that charcoal kind of hangs on to that radon laced air. And then you'll package it up and send it to the lab, and the lab is going to read off the radiation coming off that kit. So you want to just have space around the kit when you place it. As I kind of mentioned before, radon levels do fluctuate and they can increase or decrease over time. As Becky mentioned, it's coming from the soil beneath your house, the uranium. So depending on the concentration of that, that might be a lot breaking down when you first run the test. But then 10 years later, maybe most of that uranium has broken down and done that long decay chain, and you don't have as high of a level. Or as your home ages, different things might happen, or as you get new appliances, the suction effect on your home that's drawing in that air can change. So it is important, to not just test once and forget it. You should test every, I think the EPA recommends every 2 years. I don't know if you need to do it quite that often if your levels are really low, but it is a good idea to keep it on your mind and test more than just that initial test. Should testing, the last question I have before it would go over to Steve is, should testing be part of a home inspection? I think Steve and I would both say we would love to see that. It be like a requirement of real estate transactions to test your home for radon. However, I don't think that's going to happen anytime soon. So I also wouldn't want to see someone who's trying to buy a home. I wouldn't want to see them lose it to someone who's willing to waive all inspections. That, especially with the market in the past couple of years, a lot of people just waived inspections. So I wouldn't want to see you lose a home. The fact of the matter is, as long as you know to test it right after you move in, you can typically, for not too much, you can fix that issue. So I wouldn't want you to lose your home because you really want it inspected. As long as you test your home for radon shortly after you move in, it's not too much to get it fixed. So I think that's all I had for that portion.
Thanks, Skylar. So Steve, I have a radon mitigation system in my house, and I've learned a lot through this whole campaign of Radon Awareness Month. Could you talk about radon mitigation systems, like what they are, how they work, the cost, what we can do to lower radon levels and so forth?
Yeah, absolutely. So we've done a test now, and we found that we have elevated radon levels in our home. So it can be fixed, and it's the basic mitigation system vents the air that's accumulating below the basement floor, which has the soil gas that has the radon in it, accumulates there, and then slowly moves up into our basements. And the mitigation systems work very well. It's basically a PVC pipe put through the basement floor, and then a fan gets attached to that pipe, and then it gets routed outside and eventually up to the roof line. and they're very effective at getting the radon levels down. If you can go to the next slide, I have some pictures of what this looks like. So these are two very common setups that you would see for a mitigation system. The system on the left is just a 3-inch vent pipe drilled through the basement floor. This happens to be right on top of the drain tile, but it doesn't have to be. When you put a fan on that pipe and activate it, you are essentially creating a negative pressure underneath the floor, which is now attracting the soil gas into that pipe, and then you're venting it outside. Instead of it coming into the basement, you've essentially reversed the airflow in your home. The airflow now with your furnace running is that you have a negative pressure in the basement, and that negative pressure needs air to satisfy it. So it brings in soil gas that has the radon into our basements, and then eventually transfers it upstairs. The mitigation system changes that. So it puts the negative pressure below the basement floor by activating it with a fan and essentially sucking the radon out and also pulling indoor air from our homes down through the basement floor. So now the airflow is different, and it has other positive effects like drying the basement and other indoor air quality effects. So the picture on the right shows if you have a clear water drain crack for groundwater. The pipe on the left is the discharge for the water. The pipe on the right is the radon system. Very common. I did not want to do that on my home because that would have put the pipe and the fan right adjacent to my master bedroom and on my back patio, and I didn't want to see it or hear it, either when I was sleeping or when I was grilling. So I just drilled the hole. The picture on the left is my basement. I just sealed the sump crock, as you would see in the picture on the right, and drilled the hole in the floor. Essentially, my radon levels, I was at 9s in the basement, and now I'm less than 1. Very effective. Next slide, please. So attached garages can also be used for mitigation system piping. The picture on the right shows the piping coming up the basement wall, up into an attached garage, and then the fan goes in the attic space. It's very important the fan is not allowed in living space because the fan can leak radon, and then essentially you don't know that you're pumping concentrated radon into a living space. But attic space of a garage or attic space of a home, or the fan has to be outside. The picture on the left is every radon system is going to have a flow gauge, or this one is the most common style. It's called a manometer, and it's basically telling you that there is flow or suction in the pipe. And if that system ever stops working because it's plugged or the fan burned out, you will see the line will be level across and it'll be a 0. Right now it's measuring about 1 inch of mercury on that gauge, and that's normal. Systems do freeze in the wintertime. It is rare. They do freeze, and mine has froze for 2 days in about 8 years of existence. And I happened to be watching it because I thought it might freeze, and it went to 0. And then the key is don't touch it. Don't do anything. Don't turn the fan off. It will thaw out in a day or two. Once the wind changes or it warms up a couple degrees. You have to remember soil gas is 50 degrees year round. So it's going to thaw any freezing that happens. It just matters if it takes a day or two. These systems cost $1,200 to $1,400 to install. And there's a lot of mitigators in the area. There's on the state website, there's a whole list of certified mitigation companies that we can direct you to, or North Shore can direct you to if you want to get a couple of estimates. Go to the next slide, please. So this is what they look like when you get outside. You can either run the 3-inch PVC pipe, or you can switch to matching downspout material. And then essentially the discharge is up above the roof line. And once it's above the roof line, the radon's gone. You don't want to discharge it lower because you can see in the picture on the right, the window is actually open. And that's fine as long as the radon is discharging up above the roof line. And that's all been studied extensively, that you don't want it coming back in doors or windows. So that's why it's very important not to discharge it at ground level. And these are very nice installations. They look like they were well done. Question we get regularly is, can I just seal the cracks in the sump cracks in my basement and lower my radon levels? So yes, you can lower your radon levels a very small amount by doing crack sealing. Um, Essentially, the radon will move right through the concrete or cinder block walls, but you're slowing it down. It takes the path of least resistance. So if you seal a sump crack, now it's got to move through the concrete or it has to move through cracks. So it's going to slow it down. And radon is only a gas for 3.8 days. So it has to break down from uranium to radium to radon, and it's got to move through the soil and get into your home and into our lungs within 3.8 days. So if you can slow it down, that certainly helps. But crack sealing is really more important for energy efficiency, because now you're pulling the radon, you're pulling your home heated and air conditioned air now through your basement floor and venting it outside with the radon. So you want to do crack sealing and some crack sealing, especially when you're near the suction point. There's a lot more suction right by the pipe versus way on the other side of the basement. So I sealed all the cracks and expansion joints within about 20 or 25 feet of where my suction point was on my system. And I did notice a significant improvement in indoor air quality. The musty smell in my basement went away. Many people report they don't need dehumidifiers anymore, because essentially you've changed the dynamics of how your home was working before. Now, once you install a radon system, the fan runs 24 hours a day, 7 days a week. It never gets turned off. And it's about as much energy as a 40-watt light bulb. So there's really no energy consumption with a radon fan running. The issue is if you don't do good crack sealing, you're losing a lot of heated and air conditioned air, and your system's not working as efficiently. You could probably get the radon levels lower if you did a better job with crack sealing and things like that. And that's all standard practice with the mitigation companies. They'll take care of that. And certainly you can't seal cracks underneath basement carpeting and floors. That's just not feasible. So you do the best you can. But obviously big openings need to be sealed for the efficiency of the system. So are there any other solutions for radon? Absolutely. You can open a window and your radon level is going to go to zero, because the natural makeup air that your home is looking for is now coming through that window. So, but that's simply not practical for 8 or 9 months out of the year in Wisconsin. So some people do have air exchangers on their furnaces already. That certainly helps bring in some additional fresh air. That's going to dilute the radon down a little bit, but it's rarely is that a solution. Do I see a radon problem being solved by just an air exchanger that people have as an add-on feature to their home furnaces? So I think I mentioned a little bit that these systems are very effective. We have a case study of a coworker of ours that had radon levels over 100 picocuries per liter in her basement. And with her radon system running, she is now less than 1 picocurie per liter. So they're very effective. The companies will guarantee you a level that they'll get the radon level down to after the system's been running for a couple of weeks. And they also give a test as a follow-up to make sure that they met their guarantee. Are there any questions that has come up so far in the chat that we can answer before we move on to the next topic area?
While Avery checks that, I actually have a question for you, Steve. Do the fans eventually, do they die? Do they need to be replaced in the system?
Yes, and that's why so mine, whenever I walk by it, I just touch it. So I'm usually cutting the grass, and if it's vibrating, I know it's running. And when I'm in the basement, I check the manometer to make sure the gauge is reading flow. Most fans will last 10 to 20 years, and actually probably closer to the 20-year mark is what we're seeing with the fans. They last a very, very long time. They're very efficient, and they just run. As long as you're not turning them on and off, that'll kill them very quickly. Just turn it on and never turn it off, and it should last at least 10 years, probably a lot closer to 20. Most of my coworkers who have had systems for a long time get closer to 20 years with their fans.
Thanks. Avery, are there any questions?
No, not at this time.
I have a question as well. So one of the things that we talked about, oh shoot, it slipped my mind immediately. Um, okay, come back to me. We'll have to edit that from the webinar later. I'll type it in the chat though.
Oh, I'm seeing some questions now. My apologies. We have someone in the chat who said, is this an argument of no basements or less height for them? And then also a question just about the effects of radon exposure.
So I'll take the second question first. There are no short-term health effects from radon. It's the risk from long-term radon exposure is lung cancer. And the only way to know if you have lung damage or lung cancer is to talk to your doctor and get a CT scan of your lungs. So we get that question a lot. People have asthma-like symptoms, shortness of breath, sometimes when they're in their basement, and they're like, is this radon related? Nope, you're not. Radon does not cause any short-term health effects that are noticeable. And then the second question, it was related to basement versus no basement, or what was the exact question again?
I believe so. The question says, is this an argument of no basements or less height for them?
Okay, so as a general rule of thumb, the further your home is in the ground, you can have more radon. Really, it all depends upon if there's naturally occurring uranium below your home. That's really the number one factor. Then the number two factor is how far your home is in the ground. If you just have slab on grade, you could still have radon, and it's worth checking if you're ground contact. If you're not ground contact because you're in a mobile home, or if you're in a second-story apartment, this has electric baseboard heat, you don't have a furnace that's in the lower level that's bringing basement air up, you're not going to have any radon. So we see that with the protocols for testing schools and commercial buildings. They want every ground contact room tested and only 10% of the rooms above that tested. These are just, if you're not ground contact, the radon levels go down very quickly. And if the home doesn't have ground contact, it's not likely going to be there at all. The background radon levels is, if you test it in the grass, it's about a 0.5 picocuries per liter you're going to find. I hope I answered that question. If not, type it in a different way in the chat and we'll tackle it again.
Thanks, Steve. So Skylar, I think you touched on this a little bit as well as Steve, but are landlords required to test or fix radon issues? What about schools or workplaces? I know we haven't talked about this yet, but also, are there any grants or assistance for radon mitigation system? And then we did talk a little bit about selling a home, but I don't know if you have anything else to add to that.
Yeah, so there just recently, about a year and a half ago, is the first laws that were passed in Wisconsin about radon, but that was for child care facilities. So licensed child care facilities do have to test for radon and fix if there is high levels found. So that's great, but that's it. So if a landlord or a resident of like an apartment building tested their unit for radon and found high levels, there's not really a requirement for the landlord to fix it. In the few scenarios where this has come up, it seems that the landlord does, because we discussed it's not a horribly expensive fix, and it's, you lose a tenant for a month or two and you could have paid for a mitigation system. So it's not a law for them to test, it's not a law for them to fix, but if a tenant tests and brings it up to the landlord, not that I'm recommending you do that, I don't want to cause issues, but we have seen that they do tend to get worked out. As far as schools and workplaces go, the recommendation, so the EPA recommendation is that schools test every 5 years. There is no requirement for other, workplaces. But what we see in these larger buildings, so schools and commercial buildings, is they're often very low in radon, at least during occupied hours. The way those HVAC systems are set up, they're really dumping in a lot of fresh air while the building's occupied. So luckily, the schools that we've heard about being tested, again, they're not required, so we don't get sent results or anything like that, but they typically haven't found issues. But the recommendation for schools is every 5 years. There's really no other recommendations out there for businesses that I can think of. So, are there grants for assistance for radon mitigation? So Waukesha County, through like HUD, there is a low interest loan that, you have to meet certain income requirements and stuff like that. But there's that option. So I don't know with Milwaukee County, I think the best option for you guys would be to check with your local municipality. There are usually different programs, whether it's in like a community development or housing development department of your municipality that might have some funding, whether it's a no interest loan or maybe a grant. But there's not any like state or county wide grants, unfortunately, for radon, but there are some options out there. I would just reach out to your local municipality.
I can confirm that this grant, the HUD grant that Skylar is referring to, is a community development block grant, and it's a no interest loan. And there's parts of Shorewood and parts of Brown Deer that are in the eligibility catchment area that for North Shore. I'm sure more of Milwaukee County is also eligible, but just you can reach out to me or someone at the health department if you want to learn more about that.
Yeah, I think the last question in that section was if it's required when selling a home, and I think I covered that. It's not. It is becoming more common, it seems like, to have that as part of a home sale. I would just to add a little kind of note of caution. You might have a whole home inspector that offers a lot of different services. I would, if they offer radon, you want to make sure that they're doing quality control on their continuous radon monitor. We always try and recommend go with someone who's been certified because they should be doing those quality control parameters. So sometimes you might run across a home inspector that offers that as a service, but I don't know. It might be beneficial to do your own kit too, just to kind of make sure those results are accurate. I don't want to speak negatively against them. I don't think they're trying to cause issue, but I just worry in some of those cases they might not be doing the quality control on the monitor that they have. So anyone have questions about any of what I just spoke about? I think I covered everything there.
Yeah, I've got actually one question that came in. So if the radon mitigation system is kind of not feasible price-wise, are there any other options to lower radon exposure?
So
Steve, do you want to take that as part of your?
So there are not any good options this time of year. When it's nice out, a window will dramatically lower the radon levels in a home very quickly by opening windows and ventilating the home. A crack sealing, as I talked about, will help a little bit. I think the important thing is to do some testing to find out. Becky touched on it. Really, it's how high your levels are and how long you've been exposed to them. So if you're at a relatively low level, if you're at a 2 or a 3, then it's probably not something we're going to worry about. But if you're above 4 and you've been there a long time, and maybe it's something that you're just going to have to try to hopefully work with your local building or community development, whoever handles those healthy homes types things in your community, to see if there's some way that they can offer some assistance. But no, there isn't any. There aren't really any other ways other than the mitigation system for solving a big radon issue. Somebody has high levels.
So to add to that, people do sometimes express interest in installing their own mitigation system. And technically, like I have explained, there's not a requirement to have a professional do it, although we would really push that. But technically, you would have that option. It might cause a little bit of issue when you go to sell if you did something wrong. I would definitely stress not to just purchase a kit online because when the kits that Steve and I have looked at are always wrong, meeting the guidance that's provided for how to install a system. Um, but I know Steve, who is a certified mitigator, but we don't do that at the as county employees. We don't come out and install them, but he's done his house. And I think, what'd you say, Steve? The materials alone are like $400. So even doing it yourself, it's not, you know, I guess I would say the mitigation companies aren't like completely upcharging. There is quite a bit of cost to the materials too, but that is something people do consider, and we can try and help answer questions if that's something a resident wants to do. I believe it is every 2 years either way. When you have a mitigation system, it's nice to keep testing because you never know over time, there is a slight vibration created with that fan. If some of those sealed pipes might start coming loose, it is actually, I think, very valuable to test every 2 years if you have a mitigation system, just to make sure you're not inadvertently pumping radon laced air into your home because over time something's shifted and you got a crack or you got a joint that's come loose.
Yeah, atmospherically vented appliances have a huge effect on your radon levels also. So by testing every 2 to 3 years, if you've changed how you use a bathroom or a kitchen fan or something like that, that can really affect your radon levels substantially. So it's a good idea. Just whether you have a mitigation system or not, is to do it every 2 to 3 years is what we recommend.
Thank you. And another question that we received is, my home and addition were both built in 1956. Stone sub-base was not as common in this era. Will sub-pump radiation mitigation system work without gravel sub-base? The addition is a crawl space with exposed rock floor. Do I need multiple radon mitigation systems?
That's a great question, and that's where we answer a lot of those questions. So you have an older home, probably no gravel under the slab, you have a crawl space. So what we found is that crawl spaces only contribute to the home radon level about a third of the time. So what you want to do in that situation is you want to do a test in the basement and you want to do a test in the room above the crawl space, and that'll tell you the results of those tests if that crawl space is contributing to the radon level in the home. And then mitigating, and then if it is, then you can install one fan with two suction points, potentially one in the crawl space and one under the floor. They can do crawl space sealing if it's just gravel or soil by putting down plastic. So that is common, and those complex situations take a little bit of thought and in your testing and in your mitigating. So I would probably get a couple of test kits, and also if you needed a couple of mitigation estimates, because you can design the system to accommodate multiple suction points if needed, if that crawl space is a contributor. But like I say, it's only about a third of the time it is a contributor to the home down level. But that's a great question.
Yeah, in those like more difficult homes, if you want to call them, several contractors do a pressure field extension. Sometimes they'll wait till they'll install a more simple system, and if that doesn't lower the radon levels, they'll come back and do a pressure field extension test. So they basically drill little holes in various points and are making sure that that fan or that point is drawing suction on each part of the building. And if it's not, that's when they might have multiple points of suction. They might have one fan, they might need two if it's a large home and there's just no connection. So yeah, so a lot of the contractors have dealt with homes like that and have ways to kind of test what would be the best system for your home.
Yeah, Skylar's right. They usually put in one simple system, and then if it doesn't get it as low as the customer wants, then they'll go back and do some testing and figure out why aren't they getting the radon levels low enough. And it has to do with that conductivity below the basement floor.
And it being continuous and connected, does that have any impact at all? If a basement and crawl space are or in any area?
It just depends. Every situation's a little bit different.
Well, if anyone has any other questions, please send them into the chat. Meanwhile, I just have a couple more questions for you, Steve. And I know we've gone over this a little bit, but just to reiterate, does radon only affect basements? How does radon impact older homes, mobile homes, trailers?
And I think this might be a little bit about what that first question was about too, is the radon levels are always going to be highest in the basement, and they're going to go down every level you move up in the home. And that's going to vary a little bit based on if you have a forced air furnace or if you have a boiler. But essentially, the radon, as I said before, only lives as a gas for 3.8 days. So now it's in your basement. It's already almost at that 3.8 days. Now it's got to get upstairs, either through the furnace filter or cold air returns or up the stairs. And because it's a gas, it's just floating around. So the basement's always going to be highest. The first floor is usually about a third lower. And then the second story will even be a little bit lower after that. So if the basement passes, you know the rest of the home is passing. You don't have to test any further. Just test the basement. We do sometimes see a little bit, especially in like a complex home, like the one example that was came in the chat. There's probably value in that home of doing testing on both sides of the basement, because there's a lot going on there. So we do see sometimes a difference on one side. My home was a very small ranch. I never bothered testing. I just tested in the middle. There wasn't really any difference. There was only one age of construction. There were no crawl spaces. There were no slab on grade parts of the home. It was all the same age. So no, there wasn't anything unique. But no, the radon can be in slab on grade homes as well. So it is definitely worth testing. Old homes versus new homes. Becky touched on this a little bit. Generally speaking, the draftier your home is, the lower the radon levels are going to be. And but certainly if you've done a lot of weatherization work and you haven't tested in a while, it's probably a good thing to test again. There are a few new home builders that are putting in passive mitigation systems with the home construction, which would be integral to an interior wall of the home and then vented up through the attic and then up through the roof. So that is something for new homes. I touched a little bit about mobile homes and trailers. It's not generally a concern. A traditional mobile home is going to be up 2 or 3 steps to get into, so there's not really any ground contact, so there's not going to be a radon issue in that home. Certainly, if somebody's still worried about it, you can get a test kit from North Shore or from your local health department and still test. But that's my recommendation.
How does radon exposure combine with other pollutants?
So the big one is cigarette smoking. Becky talked about that. There's a synergistic effect that you're 10 times more likely to develop lung cancer if you have radon exposure and cigarette smoking. There's indoor air quality affects the radon levels a little bit. And I hate to say this, but it is true. The less dusty your home is, the less radon you're going to have in your lungs. because radon and its decay products that release the radiation are very sticky. They love to attach to things. So if they can attach to dust that's floating around in the air, that keeps it in the air longer versus just hitting a wall and attaching to the wall. So generally speaking, a cleaner home is going to have a little bit less radon floating around in the air, but not a huge difference. The other analogy I'd like to give, or example I'd like to give with radon exposure, is with how we regulate industry air pollution and how different it is from how we don't regulate radon. So if you could envision a power plant or a factory with visible air emissions, the DNR regulates those air emissions to not cause cancer in more than 5 people in a million that live downwind of that factory. Radon at a level of 4, which is very common for our area, anticipates 7 people in 1,000 to develop cancer from that, which is 1,000 times more dangerous than living downwind of a factory. So just that's something I thought was always very interesting, how we're regulating air emissions outside, but we're not worried about air emissions in our own basements from the naturally occurring radon.
If we exercise in our basement, should we be concerned about exercising and radon?
So yeah, it's you're obviously spending time down there. You're getting more oxygen and more air in your lungs. So that would be really important to make sure you know your levels are low. And that's very common. A lot of people have exercise rooms in the basement to make sure that those radon levels are low in that area where you're exercising.
Thanks. Are there any unanswered questions that the audience has? Anything you'd like our presenters to go over or add? Any additional information that people would like?
I have a.
Oh, go ahead, Avius.
There's an unanswered question. Does radon get impacted by the subfloor in the first floor?
No, it's a gas, so it essentially it's floating around the house, and it tries to find ways to get upstairs. So the subfloor generally keeps it in the basement, but if there's ways through the furnace furnace filter not being very tight, or the cold air returns, or the stairway, it finds its way upstairs. But no, it doesn't really have an effect. The subfloor does not have an effect, other than the fact that it's a barrier for the radon to move upstairs.
Julie, did you have a question?
No, sorry, that was raised by mistake.
And then we have another question coming in. Someone is asking for the contact information for the North Shore Health Department and the cost of the testing kits.
Sure. Well, I'll skip ahead. If you have more questions, by all means, we're here to answer them. But so the test kits are $7 during the month of January. They're $8 otherwise. You can come to our health department. We're open Monday through Friday, 8 a.m. to 4:30 p.m. Our new facility is located right next to Glendale City Hall, right off Milwaukee River Parkway. I'll also be sending out this information after the webinar, so you'll have this information as well. But you can also be entered to win a free radon test by filling out our survey.
I want to quick add, this is a great time of year to test your home for radon. I forgot to mention in my section that it's Radon Action Month, January is, and that's because it's winter, your home is closed. This is when levels are the highest because you got your furnace on, you're really sucking in that air from beneath your home, your windows are closed. So I really encourage you guys to act on this. This is a great time of year to be testing your homes.
Thank you for that, Skylar. If you have any more information or any other questions, please feel free to reach out to us. There's QR codes as well as links to our environmental health page on Radon Awareness, as well as how you can sign up for our newsletter. This is also going to be sent out to everybody, so you have that in your email that you registered with. But additionally, if you have further questions, you can reach out to us, because sometimes I know myself, I'll think of a question in the middle of the night and that I would have been like, man, I wish I would have asked that question. So please feel free to reach out to us as well as Southeastern Radon Information Center if you have further questions. And before I close, I just want to double check that no one has any immediate questions that they'd like answered.
No, I don't believe so. I'm not seeing any on my end.
Great. Thank you for checking, Avery. Well, then, thank you. We appreciate you taking the time to attend. It's been wonderful connecting with community members, and we really hope that you found this information helpful and that you've learned something valuable today. Again, I'll be sending out a request for survey to each one of you. If you could please fill that out, we'd really appreciate it. This is the first time we've done a webinar, and it's also one of the first times that we've really tried to raise radon awareness. So we really love your feedback. Otherwise, thank you and have a wonderful night.
Thank you.
Thanks.
Thank you, everyone.